Welcome to HCRF Talks COVID with Dr. Platanias. My name is Nicole Liadis, and joining me today is Dr. Leon Platanias, the director of the Robert H. Lurie Comprehensive Cancer Center at Northwestern. Today, Dr. Platanias is going to help us make sense of COVID-19, a novel virus that is highly infectious and spreading throughout Chicago and around the world. Good afternoon, Dr. Platanias.
Good afternoon. How are you?
Good, good. Thank you. Thank you for joining us today.
Thank you.
These are very daunting times for doctors, cancer patients, and everyone. We hear about how hospitals are sprinting to transform themselves to stay ahead of the wave and prepare for the peak in the outbreak. Can you tell us, in Chicago, do you believe that we are approaching this peak? And how is your team at Northwestern dealing with this rapidly evolving situation?
Sure. Before I answer, I want to take the opportunity and thank once again Eleni and the board of HCRF for the very great support that they have shown to us, to our doctors, to our researchers, for getting N95 masks for the Lurie Cancer Center and for Lurie Children's. We are deeply grateful, as always, for your support. So now going back to your question, the question was whether we are approaching the peak of COVID in Chicago. And if you had asked me this a couple of days ago, I would have said we may be already there. But the state of Illinois just revisited, there is an update that came that because there is a flattening of the curve, but because of the flattening of the curve, the peak is moving a little further ahead. So the projection right now is that the peak will be in the middle of May. It used to be in the middle of April. That was the original prediction. Now it has moved to the middle of May. Although the numbers are rising slowly. It's not a very acute rise. So we have been, there is a trend, I think, that we see less use of intensive care units, which is some good news there. But clearly there are more cases that are coming up, and we have not reached the peak.
So along that same lines, Dr. Platanias, what do you say to someone that says, however serious you think that this COVID-19 situation is, it is probably worse than the invisible cases? Is that true?
Yes, actually, this is something that was missed at the beginning of the epidemic, because this virus is very unusual, and no one expected that there would be such high transmissibility from people without symptoms. So at the beginning, everybody thought that it would be more like the way the flu is transmitted. Usually it's people with symptoms or a day before symptoms start. But what has come out now is that this virus can be transmitted by people who have no symptoms at all. They have no idea that they have COVID, but they are carriers of the virus, and they can give it to others. And I think that's the most challenging thing with this virus, that it is not something we are used to. We have not seen in many years something like that. It's a virus with very high infectivity, and it's kind of, is a threat. It's like this, it's an invisible threat, because it can come up from people that don't have symptoms.
That's a really interesting perspective. I'm trying to understand that this is a virus and appears to be a virus like no other that we've seen before, and the fact that it's so serious and how people can get it. So thank you for that. I also want to ask, as the director of one of the top comprehensive cancer centers in the country, can you tell us, how does COVID-19 impact cancer patients, and what is Northwestern doing to help its patients deal with this stressful situation?
So, as you know, cancer patients are at higher risk from COVID because chemotherapy, radiation, immune therapies, all of them affect sometimes the immune system and make cancer patients more susceptible to the virus and the complications of the virus. So one of our top priorities has been to try to protect our patients and make sure that they continue their cancer treatments, because cancer is a very bad disease, in a safe way. So like many other cancer centers in the country, we took very many proactive measures. We decreased the number of patients that we see in the cancer center. Instead, we have, for cases that are not urgent or that they don't need treatment, just follow-ups, we have been doing that with telemedicine. And we have decreased the, we have taken precautions to screen patients. So nobody with fever can get in the cancer center and potentially have COVID and infect others. It's a whole process that we have put in place. And that has resulted in enhanced safety, in less congestion. We have less patients that come. They're only the ones who absolutely need to come for a treatment or for something else. And but at the same time, we follow many of the patients by telemedicine. So one important thing as it relates to cancer is that we should not let the fear of COVID let cancer take over. We can delay things on a case-by-case basis, but cancer is a very serious disease and needs to be treated. So we try to balance between the, taking precautions for COVID, but making sure our patients get the right treatment.
That's so encouraging to know that the cancer patients are being taken care of and they're getting the treatment that they still need, because time doesn't stand still in terms of the course of their disease. So that's really encouraging. Now, I know another thing that's on people's mind is COVID testing. Governor Pritzker announced a few days ago that efforts for COVID-19 testing will expand to allow for everyone with symptoms to get tested. What does that mean for everyone? Should everyone with a fever or cough seek to get tested right away? What do you think?
Well, first of all, expanding testing is very important, because that will allow us to understand better how many patients have COVID and to make more appropriately design the course of response to the disease. Now, there are many tests that are available. At Northwestern, we have our own homemade NMH test. And regarding, who should be tested, there are guidelines by the CDC and what the governor mentioned. And so I think anyone who has any, symptoms suspected for COVID should absolutely, or who has been exposed to someone who may have COVID, should absolutely discuss that with their doctor, and then decide whether to take the next step to be tested. But the hope is that tests for COVID will become very routine. We test all the time for many other viruses, and it should, and at some point it will become a very routine testing. We're not there yet, but we're getting there, and that's very important. So I will say, for people who have symptoms and it sounds like COVID, clearly tests should be in their mind and they should talk to their doctor.
So do you expect there to be like a rise in the number of cases because now the testing has expanded so that people don't necessarily need a doctor's note, but can go if they have symptoms?
It's hard to know. It's hard to know. There are some early data from studies in other states that suggest that COVID is much more widespread than we originally thought. But again, it's only a small sample of the population that has been tested. So it's hard to predict. But one thing we know is that there are many cases. In 20% of the cases, the disease is very serious. In 80% is mild or moderate, but 20% have very hard time. So it is very important to, if there is any suspicion for COVID, to be alert and talk to the doctor and work on that.
Okay. Now, Dr. Platanias, many of us have been sheltered in our homes since March under the direction of health professionals and political leaders. What should we do to continue to prevent the spread of the disease? Do we need to continue this shelter in place? Do we need to continue social distancing? How disinfecting our groceries and mail and wearing a mask in public? Are all these precautions still necessary? Do we still need to be doing all these things?
They're absolutely necessary. They are more necessary than ever, actually. I think we should follow the guidance of the governor and for people in Chicago, of the mayor of Chicago, and follow the stay-at-home, shelter-in-place orders, and follow them very, very carefully, because it's so important right now. After all this effort, there seems to be some evidence of flattening of the curve. So now is the most critical moment. You want, when things seem to be going the right way, you want to really make sure that we keep going the right way. Now, about disinfecting groceries, I think that it's much safer to have deliveries instead of going to the supermarket, and be very careful with groceries. There is, yes, someone has to follow carefully to make sure that these are done appropriately. There are videos online by doctors showing examples of how to disinfect the groceries. And the same with mail, it's like you have to be careful. It's unlikely that someone will be infected by mail, but you never know. This is an unusual virus. So I think it is important to be very alert. Keep in mind that this virus there are data that it can stay in surfaces for some time. And so it is possible to have transmission, theoretically at least, by mail or groceries, and be very careful dealing with everything.
So do you see it being important to wear a mask in public for some time now, even after we reach the peak?
Absolutely. I think wearing a mask is extremely important. And, especially if you're going to be within the city, let's say, in an area that you will not be able to keep the social distance, the 6 feet that we say. Mm-hmm. Personally, I think that everyone who gets out of their house, unless they are in a very open area with no people around, I think wearing a mask is very important. Going to closed spaces like supermarkets or pharmacies, there's absolutely no question there. Because wearing a mask decreases the chances. If everybody wears a mask, the likelihood that this virus will spread goes down dramatically. So it is very important.
That's a really interesting perspective and really useful information, especially considering that you said we're approaching this peak, and knowing that it's not going to end there and that we're going to have to take precautions afterwards as well. I think it'd be really encouraging for me and all the listeners to hear about any progress. Can you please give us some examples of any progress that has been made in the fight against COVID?
Yeah, this moment, I think the major progress that has been made is the fact that what we're doing seems to be working. Like stay at home, avoiding social contact seems to be. It looks like it's going to help to really slow down this disease, and this is important because this stay-at-home order had a significant impact in preventing hospitals from being overwhelmed. You see, in Italy, there was it was a major disaster because the health system there was overrun. The hospitals couldn't, they didn't have place. There were so many people were getting it so fast. Here, especially in Chicago, we had a very good preparation, I think, and the hospitals have not been overwhelmed. We have not seen what happened in Italy or Spain, or to some degree in New York City too. So that's a good thing. Now, in terms of treatments and vaccines, one major hope is this convalescent plasma, taking the blood of patients who have defeated COVID, who had COVID and then they recovered, and their plasma can be used to be infused to other people who are very sick with COVID, and to help them fight the disease. There are also clinical trials with some drugs that may have activity. It's very early to say, There is a drug called Remdesivir that is in clinical trials and is here at Northwestern. So we'll see. The vaccine is going to take time, but there are a lot of efforts there. And there has been such a mobilization of the scientific world to work to make a difference there. We are a cancer center, and we are now started sponsoring research for COVID. So I want to be cautiously optimistic that we will see some progress there, but it's very hard to predict at this point.
So are these clinical trials taking place everywhere in the country, Dr. Platanias?
No, there are selected places. There are many clinical trials across the country with many different drugs. And but not all of them happen in all places. There are selected places for some of them. For this drug, for instance, we are 1 out of 2 places, I think in Chicago, there may be more, that have this trial. But there is, you will see more and more trials coming up the next few weeks as people make more discoveries. There is a tremendous amount of research going on right now, and people come up with new ideas and new approaches, and I think we're going to see a lot of activity there.
Okay, so as we finish up, what are your hopes in the fight against COVID-19? What can we hope to get in the fight against COVID next week or the weeks to follow?
The important thing will be to control the spread of the disease. This disease will be around for a long time, and it's going to be a threat for a long time. But social distance and precautions and decreasing the chances of spread is what it will make the difference. I think we're on the right path right now. It will be extremely important to continue that, follow the guidelines by the CDC and by the governor and the mayor, and make sure that this is a collective effort of all the American people to try to fight this disease, and everybody has their part into this effort.
That's encouraging to hear that we're moving in the right direction. Thank you, Dr. Platanias, so much for being here with us and sharing your expertise with everyone at HCRF and beyond. Your thoughts about COVID crisis have been so insightful. I also want to thank you and your frontline workers for adapting and positioning yourselves to stay ahead of the wave and make a difference for everyone in Chicago. We are beyond grateful for their bravery and sacrifice during these unprecedented times. I would also like to thank our listeners today. We have HCRF board members, and everyone else listening. This concludes our segment of COVID Talks with Dr. Platanias. If anyone has questions for Dr. Platanias, please email us and we will be back next week to talk more about COVID. Also, in the meantime, please reach out to HCRF to find out how you can help Dr. Platanias and his team make a difference for cancer patients amidst this COVID virus. See you next week.
Thank you.